Greg. All right, hey, this time of the year with the weather you just got a moment ago, allergies are likely driving you crazy. The cool, dry air can make our dry eyes even more of a problem, and I'm experiencing that firsthand, actually. Dr. Jeffrey Whitman with the Key-Whitman Eye Center joins me with more on what you can do about those allergies and dry eye. Great to see you.
Great to be here today.
I know, what is dry eye?
Well, first of all, we have to understand that dry eye is really a serious problem that for many requires lifelong treatment. And to understand dry eyes, we have to understand that the tear film that lubricates our eye is actually made of 3 different layers: an inner mucin or mucus layer that smooths out the surface of our eye, the cornea, an middle aqueous or watery layer, and an outer oil layer that's secreted by the meibomian glands along the edge of our eyelid that helps protect the other layers. And if any of these layers get out of whack, we're going to have dry eye symptoms.
Okay. Hey, speaking of these symptoms, share the symptoms because it's more than what you might think.
Well, typically we'll see patients come in with irritation, redness, stinging, even itching, which can simulate allergic eyes, but it's really dry eyes. And we'll find patients that will have foreign body or gritty sensation. It'll be scratchy when they blink. And we'll have some patients that'll say, hey, doc, my vision kind of fluctuates. When I blink, it gets all kind of smeared and then it clears up again. Again, typical dry eyes. And what a lot of our viewers may not know is that people with severe dry eye can have excessive tearing, we call reflex tearing, due to the irritation. But unfortunately, these tears really don't lubricate well.
I see. I hope you don't mind. I'm going to be very transparent with everybody. I went and got my eyes checked, and lo and behold, y'all, I had dry eyes. I had no idea, but I did have some of these symptoms. I thought it was just allergies, but now I have a solution, and I feel much better. So I had no idea that I'd be affected by it. But who is affected by dry eye?
Well, anyone can be affected by dry eye. The majority of patients that come in are generally 50 years of age and older, much more female than male, so there's probably some hormonal or chemical basis for this. And even certain medications like antihistamines and antidepressants can lead to dry eye. And we also see a lot of younger patients now that are chronic contact lens wearers that, well, you can see that if you wear contacts and you have a little bit of dry eye, that's going to really cause some irritation, made it difficult to wear those lenses.
What treatments are available?
Well, the treatments have gotten better and better. Now, the mainstay of treatments are generally our artificial tear drops. I'll show you some here: tear drops, gels, ointments, all of which are designed to help lubricate that surface of the eye. Then and by the way, these aren't the typical drops you see going down the grocery aisle, because we try to recommend tears for the specific layer that's causing the problem. For our moderate dry eye patients, we may recommend a nutraceutical like Hydro Eyes, which is a vitamin-like preparation that helps supplement and normalize the tear film. But for our chronic dry eye patients, we have some really great treatments now.
Okay, well, tell us more about it.
Well, most chronic dry eye is caused by problems with those meibomian glands, those oil glands I was talking about, that lie along the edge of our eyelid where the eyelashes come out. And these can get clogged up. And the treatments I'm talking about are designed to help with that. And we have LipiFlow, IPL, and the iLux procedure, all of which are designed to warm and help express open those oil glands that have been clogged up to help normalize the tear film. And the treatments don't take long at all, and they're painless.
Are they covered by insurance?
Well, unfortunately, the treatments aren't covered by insurance, but at Key-Whitman, we've really worked with the companies that make these products to get the price very affordable. And my dry eye patients tell me all the time that the cost is well worth it to get rid of those symptoms. And their long-lasting effect, they can last from 6 months to a whole year.
And you have locations all over town. You're making it easy for folks to get to you.
Yes, we're easy to get to, and all you have to do is call or set up an appointment online. But let us know that you're interested in some of these advanced dry eye treatments, because the LipiFlow, IPL, and iLux procedure, we only perform at the Dallas and Plano offices, so we want to get that appointment set up at the correct location.
All right, take note to that. But if you want to give him a call, I'm about to give you that number. Great to see you, Dr. Whitman. Thanks for joining us.
Great to be here this morning.
All right, have a great day. Remember, the IPL and the LipiFlow, they're only available in Dallas. And the iLux is in Plano. So take note of that. As I mentioned, here's the number, 214-220-EYES. That's 214-220-3937. Everything is online at Key-Whitman.com to schedule that appointment. Jane?